See, hyperparathyroidism can be of two types. What is first basically hyperparathyroidism? Increased PTH secretion, parathormone secretion is called as hyperparathyroidism. Increased parathormone secretion is called as hyperparathyroidism. When a parathormone should come into play, there can be two types. One is primary hyperparathyroidism. Another one is secondary hyperparathyroidism. Another one is secondary hyperparathyroidism. Example for primary hyperparathyroidism is parathyroid adenoma. Parathyroid adenoma. Adenoma means tumor in the parathyroid. So once tumor is seen in the parathyroid, it won't ask you anything. It will keep on secreting parathormone. So that is called as primary hyperparathyroidism that can occur in parathyroid adenoma. When secondary hyperparathyroidism can occur, example is renal failure. Whenever a patient has got renal failure, okay, the calcium level falls off, and because of that parathormone increases. So such a condition is called as secondary hyperparathyroidism. First we will see what is happening in the primary hyperparathyroidism, and then we will go to the secondary. So in primary hyperparathyroidism, what is the material which is secreting more? No, parathormone is secreting more. So when parathormone is increased, what is the action of parathormone? It increases calcium release from the bone. Calcium is released from the bone. When calcium is released from the bone, what happens to the bone? The bone becomes weak. The bone becomes weak. In the kidney, it increases calcium reabsorption. In the kidney, it increases calcium reabsorption, and it also increases phosphate excretion. It increases phosphate excretion. Since the bone activity increases, alkaline phosphatase also increases. Okay, so when you take the blood, in the blood you will have more calcium, you will have more alkaline phosphatase, but there will be decreased phosphate in the blood. So this is picture of primary hyperparathyroidism. Can you understand this? Okay, in primary hyperparathyroidism, when you take a blood and if you test the blood will have more calcium. That means there is hypercalcemia. There will be increased alkaline phosphatase, but the phosphate level will be decreased in the blood because of parathormone action. What is secondary hyperparathyroidism? Secondary hyperparathyroidism is commonly seen in a condition called as renal failure. So we call this as renal osteodystrophy. Renal osteodystrophy. Osteodystrophy. Okay. Now, what happens in renal failure? What happens in renal failure? If you go back to the vitamin D production, how vitamin D is produced? How vitamin D active form is produced? How? 25-hydroxycholecalciferol. 25-hydroxycholecalciferol is acted upon by 1-alpha-hydroxylase in the kidney, and then it becomes active form. If kidney is not functioning, this enzyme will not work. So vitamin D formation will not happen. Once vitamin D formation is not happening, calcium level automatically falls. Okay, this is one mechanism. So in a renal failure, vitamin D synthesis decreases. So automatically calcium absorption from gut and kidney decreases. When renal failure happens, in the kidney, calcium is excreted more and phosphate is retained more. And phosphate is retained in blood because of renal failure. Now what happens here? Calcium is excreted, calcium absorption is decreased. So all this leads to hypocalcemia. All this leads to hypocalcemia. Once hypocalcemia occurs, parathormone will start acting. So parathyroid will secrete parathormone. Parathyroid will secrete parathormone. This type of parathormone secretion happening in renal failure is called as secondary hyperparathyroidism. Secondary hyperparathyroidism. Now, when parathormone is released, what does parathormone do? It has, what is its function? What is the function of parathormone? What is the function of parathormone? It has to increase the blood calcium level. Okay, it has to increase the blood calcium level. It cannot act on kidney. Kidney is already in failure. So what it will do? It will act only on bone, and it dissolves the bone and it releases the calcium from bone. And it releases the calcium from bone. So much of calcium is released from the bone. Hemorrhage happens in the bone. Hemorrhage happens in the bone. This hemorrhage becomes hemosiderin, which is brown in color. Hence, in secondary hyperparathyroidism, the bone is suffering from a condition called as brown tumor. So, secondary hyperparathyroidism is also called as brown tumor. Secondary hyperparathyroidism is also called as brown tumor. Okay, I hope you can be able to follow what I am telling. So, when kidney is not functioning, parathormone will take all the calcium from the bone only, because no function of the kidney. When kidney is not acting, vitamin D synthesis will not happen. From the gut also, vitamin D won't, calcium won't come. So only from the blood, only from the bone, the parathormone will be taking out calcium. So the bone destruction will be so much. Hemorrhage occurs within the bone. Those hemorrhage converts it into hemosiderin, which is brown in color. Then hence the term brown tumor. Hence the term brown tumor. Okay. Whenever hyperparathyroidism occurs, the vertebra gives an appearance called as rugger jersey spine appearance. Rugger jersey spine appearance. Rugger jersey spine appearance. Okay. So in a secondary hyperparathyroidism, if you take the blood, in the blood, calcium level will be low, phosphate level will be more, and alkaline phosphate level will be more. And alkaline phosphate level will be. So this is the blood picture of secondary hyperparathyroidism. What is the difference in blood picture of secondary hyperparathyroidism and primary hyperparathyroidism? What happens in primary hyperparathyroidism? If you see the blood picture, calcium is more, but phosphate is low. Opposite happens here. Calcium is low, phosphate is more. Because of renal failure, calcium is low and phosphate is more. This is very important point. MCQs can be asked based on these blood investigations. Okay. So you treat the renal failure, you can treat this condition. That is how you treat this one. Paget's disease. Paget's disease. What does Paget's disease mean by? Paget's disease is a condition where both osteoclastic and osteoblastic activity is increased. Both osteoclastic and osteoblastic activity is increased. They are not going in a proper coordinated manner. They are going in an incoordinated manner. So bone is deposited. So bone is deposited by osteoblast and it is destroyed by osteoclast repeatedly. Deposition, destruction happens frequently in Paget's disease. Because of this, the bone becomes weak. The bone becomes weak. So in Paget's disease, there can be a lytic phase because of osteoclastic activity. There can be a blastic phase because of the osteoblastic activity. If both of them occurs, it can have a mixed phase. So these are the three phases in Paget's disease. If lytic activity is more, then it is called as lytic phase. If blastic activity is more, then it is called as a blastic phase. If both are then that is called as a mixed phase. So these are the phases of Paget's disease. These are the phases of Paget's disease. Once these kind of activity happens in the bone gets weak and it is more prone for fractures, more prone for pathological fractures, more prone for pathological fractures. Okay, you treat this condition with the drugs like alendronate. With the drugs like alendronate, you treat Paget's disease with drugs like alendronate. Then there is a condition called as osteopetrosis. Osteopetrosis is also called as marble bone disease. It's also called as marble bone disease. It's also called as marble bone disease. What happens in osteopetrosis? Here, osteoclastic activity is defective. Osteoclastic activity is defective. What is the function of osteoclast? Anybody knows what is the function of osteoclast? Resorption. See, for example, if a bone is formed like this, okay, the osteoclast should act on this and it should convert the bone into a structure like this. Bone will be a bone will be like this or a bone will be like this. How a bone will be? 1 or 2 is right. 1 or 2 is a bone will be like this or a bone is like this. 2. Always when you see a bone has got a cavity in the center. What is this cavity called as? Medullary cavity, marrow cavity. Inga marrow cavity iruka? Illa. What is the function of marrow cavity? What is the function of marrow cavity? Inside the marrow cavity, you have got hematopoietic cells. What does hematopoietic cell do? They produce the RBCs. They produce the WBCs. Okay. Now just imagine this bone, if it has to convert into bone, inga bone resorption nadakkunulla, appadana or cavity create agum. Only then the cavity will be created. So for this, osteoclastic activity is important. If osteoclast doesn't function, this formation will not happen. Then the bone will become completely without marrow cavity. So when marrow cavity is not there, hematopoietic cell production is not there. Hematopoietic cells are not produced. When hematopoietic cells are not produced from bone, what are the other sources of hematopoiesis? Other sources of hematopoiesis? No, more than kidney, liver and spleen are the other sources of hematopoiesis. So they enlarges, resulting in hepatomegaly and splenomegaly. So in a marble bone disease, the patient will have hepatomegaly or splenomegaly. Na solradhu puriyudunga? See, normally hematopoiesis should occur in the bone. Most of the hematopoiesis it has to occur within the bone. But for that to happen, you should have a cavity within the bone. If marrow cavity is not formed, so hematopoiesis cannot happen. Secondary hematopoiesis occurs. Where are the organs? The liver and the spleen are the organs which causes secondary hematopoiesis. So they enlarge in size, which is called as hepatomegaly or splenomegaly. Okay. So a patient with osteopetrosis will also present with hepatomegaly and splenomegaly. They will have decreased WBCs, hence they are more prone for infections. Hence they are more prone for infections. Okay. Very important point. When you take X-ray of this patient, the X-ray will show a widened metaphyseal diaphyseal junction, giving an appearance called as Erlen-Meyer flask deformity. Erlen-Meyer flask deformity is seen in osteopetrosis. Erlen-Meyer flask deformity is seen in osteopetrosis. Okay. So this is how osteopetrosis will present to you.